Good evening, everyone. How would you feel if I told you that when you got an immunization, less than 20% of that medication was actually reaching your bloodstream? Well, while this may not be the case, for patients with asthma and COPD, this is a daily occurrence. When a patient misses at least one critical inhaler step, the amount of medication that reaches their lungs is below 20%. And this is a common occurrence. Roughly 93% of patients miss at least one critical step when taking their inhaler. For your common asthmatic, this will result in things like poor symptom control, limit their day-to-day abilities, and in some cases, put them in the hospital. So to solve this problem, we've created BreatheSuite. BreatheSuite is a device that will attach to inhalers to train patients in real time to properly take their inhaler. This BreatheSuite device will track all critical inhaler steps and ensure that this information is transmitted in real time to a smartphone where the patient will be given updates on their technique score for each dosage and given tips in order to improve on that in the future. So here's your current solution. The solution to poor inhaler technique right now is known as the spacer device, widely used in young children. However, the problem is that doctors struggle with getting their adolescents and adults to use these devices as a result of their lack of portability to carry around. Additionally, according to a study done by the University of North Carolina in March of last year, there was actually no electronic device on the market which will currently, in real time, add onto an inhaler and track all proper technique steps, hence creating a large opportunity for BreatheSuite. Additionally, we plan to track things like adherence to ensure that patients are getting the most, or are reminded of each inhaler dosage and never forgetting a dose. So while this has obvious benefits for the patient, this actually benefits the doctor as well. They'll be able to transparently monitor their patients and spend less time in the clinical environment teaching on how to properly use their inhaler. For insurance companies, who often pay for some of these inhaler medications, they'll notice cost savings on less wasted medication and unnecessary hospital admissions. So let's look at an example. So let's take a patient who is prescribed 4 puffs daily. If they struggle with inhaler technique, they'll often take 1 or 2 extra per day to relieve their symptoms. This equates to about 14 inhalers that could be used per year. For the BreatheSuite device, we estimate that we can take this number from 14 down to 12 by removing this extra puff per day. By charging $50 for each BreatheSuite device, we can actually save the patient and insurance companies $220 per patient per year. And when you look at the amount of patients there are with COPD and asthma in North America alone, this represents almost $8 billion in potential savings, representing almost 15% of total expenditures on asthma and COPD in North America. And the market for this is extremely large. In North America alone, there's 36 million patients who struggle with asthma and COPD, and if we charge $50 per device, the revenue for this would be about $1.8 billion. And we've actually gotten out and we've spoken with a number of these key players. We've conducted almost 70 interviews with pulmonologists, insurance companies, pharmacists, and patients to understand their problems and ensure that they are addressed in our product. And as a result of these interviews, we've actually secured offers from 3 clinical trials in hospitals across Canada, which shows benefits in our product in the real clinical environment. So the team, my name is Brett Vokey, and I'm a mechanical engineering student at MUN, and I'm the founder of BreatheSuite. We have an extensive list of mentors, one of which who's actually doing his PhD in mobile health and how that specifically relates to patients with COPD. Additionally, we're excited to bring on 2 new engineers in the summer who will help drive product development. So if selected for this $10,000, we plan to leverage this money with the NRC IRAP program, who we're already in discussions with on creating a technical project. We plan to use this money to continue to develop our product and ultimately start stage 1 of our clinical trials. When we then continue our clinical trials across Canada, we plan to get classification approval through Health Canada and ultimately drive towards sales. So we're BreatheSuite, and we're looking to allow patients with asthma and COPD to get the most out of each inhaler dosage. Thank you very much.
Okay, great job. Thank you for your presentation. And now, the judges, if you have questions.
Brett, thank you so much. Very inspiring presentation. I have 2 why questions. So why are you by yourself? Why don't you have a co-founder or someone particular in your team? And then the second why question is, why hasn't another company done this so far? I mean, like, this has been something that's been going on for years and years and years. to me that, you know, is it just because of your brilliance, or is it because there's something that maybe I'm missing?
So first of all, I guess I can kind of use this as a selling point. I'm still looking for a co-founder, so if anyone's interested. And on the second side of this, there's been multiple efforts to create another solution. So there's been things like training videos that have happened in the past. Essentially, nothing has created a device which attaches to inhalers. So there's also devices on the market right now which work as like fake inhalers, which will train patients to use it properly. However, none of these are really effective because it's not giving them real-time feedback when they're actually taking their inhaler. So that's kind of how we differ from the solutions in the past and how we hope to actually succeed.
Awesome, thank you.
Very well done. First, quick question. Did you write all of the documentation and the pitch, the pre-package that we received?
Yes, I did.
Okay, it was exceptionally well done. You know, when you're able to express your ideas in the written as well as the verbal, it's a huge advantage. It's a skill we're losing, unfortunately, in education. So, one of the questions that I had was, I admire the list of advisors that you have. Have you spoken to insurance companies?
Yes, I have.
Okay, can you tell me a bit about what you learned there and how that might play out?
So when I was talking to insurance companies, I wasn't necessarily pitching them the idea. When I conducted these interviews, I wanted to learn more about how something is approved through these insurance companies. And I tried to get some information about the money that they spend for asthma, but they didn't really tell me any of that kind of stuff. But yeah, those interviews were more to learn about the processes that I need to go through in order to get these devices approved by these insurance companies. And I think I do understand that process now as a result.
Okay, great, thanks.
Hey, Brett. Am I right in thinking that asthma is something diagnosed very early in life?
Yes,
and
yes.
that COPD is perhaps later in life?
Yes, that is correct.
Okay, that's good, because I have a question based on that assumption. I'm curious how you were thinking about designing the education interface that's going to be accessible to two very different demographics.
So I guess the main target market that we have is actually, we're not going to target those young children because they are essentially the ones who are actually using these spacer devices. We're going to target the adolescents and the adults who don't want to carry around these spacer devices in public and essentially create a device that's accessible for them. And while there will be technology concerns in terms of integrating it with the app, we believe that we can also create a device which can, I guess, give them notifications on the actual device as well if they're doing it correctly. So that's something that we're looking into as well.
Okay, I think there's some interesting opportunities, to look at the age at which someone transitions from that bulky device to your product and what sort of learning stage they're at and what learning styles are appearing sort of at the general population there. And then also, how do you create an interface that's going to work for someone who's diagnosed with COPD later in life and is, perhaps various levels of cell phone literate to understand the data that you're providing to them that's useful, but not if they can't interpret it.
Yeah,
or
absolutely.
they feel, disengaged from it.
To answer your first point there, the kind of the age that someone transitions from this device, it's supposedly supposed to be never, like they're supposed to always use that device. However, doctors say that around age 10 is when patients stop using those big face mask and spacer devices. One benefit to my product is that you can use it. It doesn't have to be their device. It could be their parents' smartphone device or something like that. And all the data would be stored on the actual device itself. So similar to how a Fitbit works, as soon as you sync it up, you can tell how their technique has been throughout the day and monitor it that way as well.
Great, thank you.
Thanks, Brett. That was an amazing presentation and the document you put forward. Like, you sure you're not a business student?
I swear.
A lot of business courses. And I love the question you posed to the insurance. That was very business-like of you and probing and trying to get that out. And that was amazing insight to go and do that. Also, have you looked at, Medicare in Canada, of course, the budgets and stuff, no one is a reactive approach to medicine, whereas U.S. is spending a lot more per capita on medicine. Have you looked at the U.S. market and distributors more and talked to many people in the U.S. or did research outside of the Medicare program?
Yeah, so a lot of our interviews were actually with people from the US as well. One thing to mention, so I did talk a lot about wasted medication. So those insurance companies, no matter if it's in Canada or the US, those are the ones who are paying for it. But when someone shows up to the hospital with uncontrolled asthma, these insurance companies would also be paying for that in the US, whereas in Canada, this would be the government who would be paying for this. So in Canada, the government would also benefit from a device like this. So yeah, we have been talking to people from the US and we'll continue to conduct those in our interviews and ultimately drive that as a market that we look to expand into.
Thanks.
Good presentation. Two quick questions. In terms of the product and its life cycle stage, is there a prototype? Where exactly is the product? Maybe you answered and I missed that already. And then in terms of your personal plan, where are you in school, and are you bought into building this business? Is it just a possibility? Because again, it seems like you have major personal tie-ins to this problem. How much are you committed to this venture today and trying to drive it forward, and the stage of the product?
Yeah, so what was interesting is that when I started this company, the idea was actually completely different. And when I started talking to some of these pulmonologists who are like the asthma doctors essentially, they were the ones who were telling me about the problem with inhaler technique and how it hasn't been solved. And that kept coming up in every interview, so I decided to kind of change the product towards that. And as I've been talking to more doctors now with the actual idea, seeing their enthusiasm when I bring forward the idea and like how they believe it's going to solve the problem is inspiring for myself. And I think that's a real driver going forward for myself to continue on working on this business and hopefully find a co-founder out there too. So.
So tell me about this co-founder you'd like to find. What are the key skills, attributes? Where do you see your strengths, and what are you looking for?
Well, I think throughout so I'm also doing an entrepreneurial work term. I was one of the healthcare job shadowers as well. And as a result, I've kind of developed some business skills from that sense. In terms of like electronics engineering and software development, that's not exactly my strong suit, as I'm a mechanical engineer. So someone who can work directly on the technical stuff while I help with the technical and ultimately drive business as well, that's probably what I'd be looking for in a co-founder right now.
So Brett, how many interviews? I think you said you've done 76 interviews. Is that right, or is
yeah, just below 70.
Okay, so and you've done every one of those interviews yourself?
Yep.
That's impressive. At which point, so you've designed it, you've marketed it, you've done all these sort of things. What would you like to give up first from all these things that you've been doing?
I would say probably, I don't know, that's a hard question to answer.
That's why we're here.
Yeah. I would definitely like to stay in the design side of it. As a mechanical engineer, I kind of gravitate towards the technical things. I'm also interested in the sales, but maybe the marketing perspective of actually marketing this more out to doctors, that would probably be something with someone with a marketing background could actually definitely help me with. So
that's
that would be my choice, yeah, to give up if I had to give up any.